Hi, good afternoon and good evening, depending where you're calling from tonight. My name is Andrea Weddle, and I'm the Executive Director of the HIV Medicine Association of IDSA. On behalf of HIVMA and the Ryan White Medical Providers Coalition, we want to thank you for joining us for today's webinar entitled Educating Policymakers to Achieve Results. This is the second webinar in a series that we are sponsoring with support from the MAC/AIDS Fund to assist HIV providers with educating policymakers on the value and importance of the Ryan White program. The first webinar focused on how to effectively communicate a message to policymakers and the media and is available on the HIVMA website in the Ryan White section, and we'll share a link to that following tonight's presentation. Before we get started, a couple of quick housekeeping issues. Today's webinar is being recorded and will be available for replay on our website. And we have muted all the phone participant lines, but we will be opening the lines up at a couple points during the presentation to take questions. You also may submit questions using the questions box that should appear in the dashboard dialog box in the right-hand corner of your screen. So now I'm really pleased to introduce Jenny Collier, who has convened the Ryan White Medical Providers Coalition since 2009, and who is the founder of Collier Collective, a DC-based consulting firm. Ms. Collier is a public interest attorney and consultant who provides strategic, political, policy advocacy, and coalition building services. She has more than 2 decades of experience in healthcare and criminal justice policy issues, including federal appropriations, addiction, HIV/AIDS, Medicaid, juvenile justice, and criminal justice. She will be joined by Robin Strongen at a couple points during today's webinar, who's the President and CEO of Amplified Public Affairs, to help respond to questions and to help with issues around messaging. So I'm really pleased to turn it over to Jenny, and we'll be back during the question and answer period. Thank you, Jenny.
Thanks so much, Andrea, and thanks, Robin, for joining us. And welcome, everybody. I'm glad you could join us today for this webinar, part 2 of a 2-part series. And this one is about educating policymakers to achieve results. Just a couple of quick points before we get started. When we're talking about policymakers today, we're talking about both federal policymakers in Congress and the administration, including congressional staff and other administration officials and staff that we may be talking to about the Ryan White program. But we're also talking about tips and strategies that can be used for state, federal, and local officials that you may interact with regarding your program, regarding local HIV issues or statewide HIV issues. And so please note that the types of things we're being trained on today can really be adapted for all of those audiences of policymakers. And really, we're talking about decision makers at both the administrative as well as the legislative level. Also, the strategies that we're talking about today relate both to the Ryan White program as well as to broader HIV healthcare coverage issues. Obviously, the ACA is in the news, and there's a lot going on right now. And so, again, the strategies are very applicable to all different kinds of policy issues in the healthcare space that we're working on. So I'm really glad that you could join, because leadership really does include citizen advocacy and participation in government. And my favorite quote about that is from President Lincoln's Gettysburg Address, where he said the United States has a government of the people, by the people, and for the people. And as we saw this weekend, we really saw citizen participation and advocacy in government in a way that was defined by protest, by external protest outside of the government operations, people hitting the streets, speaking their minds, communicating with media and their physical presence that they want to take a particular position. What we're talking about today, though, in terms of citizen advocacy and participation is really more of an inside strategy, talking with policymakers that are working inside the mechanisms of government and figuring out how to best work with them to achieve policy change in that realm. These 2 types of policy advocacy are certainly not mutually exclusive, and there are other types of policy advocacy that work in concert with these types of advocacy strategies, such as digital strategies, social media communications, all different kinds of strategies. But I just wanted to say that we really are at a time now, next slide please, where we are having a real surge in citizen participation, because I think there's a lot going on in our country. People are really expressing themselves and are potentially concerned or excited, depending on which side of the aisle you're on, about what's coming up. And so this is a perfect time for us to be talking about how to hone our skills and up our game in terms of doing this type of policy work and advocacy. In terms of effective education of policymakers, is it possible in this new environment? And I want everybody to come away from this webinar saying, yes, it is still possible. I hope you all won't be distracted in the coming months by the noise and the chaos and the anxiety that I know many people are feeling right now. And there are a lot of things that people are worried about, and there is a lot of uncertainty. But the good news is that effective education and advocacy principles do remain the same. The kind of strategies that I've practiced for 20 years throughout a range of different types of administrations and Congresses in terms of who controls them and what the issues of the day were, they've really, to a large extent, remained the same. So I'm glad that you're joining us today to learn them and help us stay the course so that we remain focused on our advocacy and the ways we can accomplish what we need for ourselves, our clinics, the patients you serve, and health policy generally. But obviously, while principles and strategies may stay the same, we obviously have to adapt to any new environment or changes. And in this case, I think that really means building new relationships and using arguments and techniques that are persuasive to your audience. So, for example, we're going to have to build new relationships with a new administration. That happens every 4 to 8 years. Anytime a new president is elected, things change over. So that's par for the course. We have to make sure we're learning leadership for the new Congress, and that might mean new leaders of particular committees, which rotate on a regular basis. People may have retired and been newly elected to replace folks. So there are all different kinds of relationships that we're going to have to spend time building. And then also in terms of persuasion, for this Congress, for example, it's a more conservative Congress, and they care a lot about outcomes, metrics. What are we using Ryan White monies for? Are we getting good outcome data, such as are viral suppression rates getting better? Those kinds of things might be more important to show in this type of environment than perhaps talking about how everyone has a right to health care and assuming that everyone agrees with that. So, again, we're just going to think carefully when we're meeting with new people and making new relationships and giving arguments for the things that we want to achieve, that we're using the most persuasive types of arguments and information for our given audience. Next slide, please. The advocacy challenges and opportunities today are quite a lot, but I think the key things to focus on, because there are both challenges and opportunities, I think the most important one is that for us, healthcare is right now an urgent issue, and policymakers want to address this issue right now. So that is both good and bad. The good news is that we don't have to beg for attention. We don't have to spend a lot of advocacy resources figuring out how to get people just to think about our issue. But at the same time, this is a situation politically where on the federal level, it's one-party rule, and so they can make changes very rapidly. So we're going to have to spend a lot of time in the next few months following an issue that's going to be fast-moving and regarding healthcare. And we're going to have to think about and come up with information, data, strategies, policy recommendations on a very fast timeline potentially. And so that can be a challenge because everyone has limited resources and time. And so that's something to think about. Something to remember in this environment is that party affiliation does not always equal policy positions. All politics are local, right? Everybody gets voted for at some point if they're elected or appointed. They need to be in the good graces of the ruling caucus. And so, people will listen to constituents, especially medical providers. And it's really important to not go into particular offices or meetings assuming that because somebody might be affiliated with a particular caucus or a party that they're going to feel a certain way. You have to give them a chance, just as they're giving you a chance to hear your arguments. And you have to make the case that people in their districts or in their localities have the same kind of position that you do. And so don't assume because somebody's party affiliated that that means they feel a certain way. And then lastly, don't be daunted by the fact that sometimes it takes years to accomplish your goals. We have to think long-term, and we have to marshal our data and arguments, and we have to not give up. I've worked on issues that have taken me 20 years or more to accomplish real change on, and it has been back and forth. Sometimes I've gained ground, sometimes I've lost ground. Sometimes things happen on an annual basis, like with appropriations funding. Federal funding is appropriated every year by Congress, and so we have an outcome every year. So you really just have to know that for the kind of issues that we're dealing with, some things will be very quick, but some things will be long-term, and gaining support for the Ryan White program is a long-term effort, and it's a real educational effort. Next slide, please. As I mentioned, HIV medical providers are effective educators. You'll see some of them here, our motley crew that comes to Washington. This is a great group of providers that are part of the Ryan White Medical Providers Coalition. And they've been coming to Washington, meeting with people at the White House, meeting with people in Congress, meeting with people at HRSA and the HIV/AIDS Bureau there. And so you'll see, that it's possible to come to DC as a medical provider and be heard. Next slide, please. And some of the reasons that you guys are great, effective educators is that you are viewed as responsible. You have responsible jobs. You take care of life and death situations. You take care of very sick people. People respect you for that. You're affiliated with important community institutions. Many of you work at hospitals, universities, health centers. These are major institutions in our communities that are respected. They're huge employers. They, are long-standing community centers or places of note in local communities, and so they have an influential base and are seen as important. You're personally knowledgeable and an expert, not just on HIV, but other medical and healthcare issues, and people respect you for that and want to seek your expertise when they get to know you oftentimes, and that's something that we're going to talk about leveraging. Also, you do this every day. You make complex issues simple. So you simplify things that are very difficult to understand, just like when you educate your patients about HIV for the first time or about new medical issues. The same kind of process is used for policymakers. We break it down. We make it simple. The elevator speech, 30 seconds, explaining something, using pictures, diagrams, charts to explain things. That might be more complicated, but a picture is worth 1,000 words. You all have those skills already, and you use them every day. And then finally, you guys know a lot of people. You're influential. Not only do you know your patients and all the people that work with you, but oftentimes you know people at the universities and health centers and hospitals where you work. You know people in your community because you're active in your community. Oftentimes you'll go and be affiliated with a religious institution or another educational institution like your kid's school maybe, or you have hobbies, sports, other activities that you engage in. So these are all things that help make you influential. You see and know and talk to a lot of people. So for all of these reasons wrapped up, HIV medical providers are extremely effective educators. I've gotten some of my best nonpartisan outcomes in terms of all the advocacy I've done for 20+ years with people who are working as medical providers. So feel confident that people want to hear from you. Next slide, please. I just want to show a couple of pictures. This is a group of providers from North Carolina from a different jurisdiction each that went to go educate a Republican member of Congress, and they could talk about what was happening throughout his state. Next slide, please. Next slide, please. There are two pictures here. One on the left is Dr. Thornton, who is at a Hill briefing, actually educating congressional staff about the Ryan White program. We've done that before in concert with other organizations and have drawn on your expertise to bring it to the congressional staff who need to learn about these issues, and it's gone over very well. The other picture to the right is two providers from Ohio who are going to go see a Democratic member of Congress who's on the Appropriations Committee, and that was really helpful because they could answer a range of questions about what's happening both in his district as well as other parts of the state that he might be interested in. So next slide, please. I want to just stop before we get into educating policymakers and see if there is any burning questions now that folks want me to answer before I move on, please. We're going to open the line so that people can ask a question or two. If there's something burning.
Process.
Any questions? Your lines are open. If not, I'm going to move on.
Full-time assigned chief.
Okay, I think we're going to move on, but if people want, we're going to mute your lines again, but if people want to type into the chat box any questions. We will keep track of those and seek to answer those, and there will be 2 more times for questions. So here we go. We're going to educate policymakers. Next slide, please. To be effective in terms of educating policymakers, there are 3 things that I think are really true that folks need to be. 1 is reliable, the 2nd is accessible, and the 3rd is persistent. These are things that you need to be when it comes to doing your job well, when it comes to dating and having relationships. These are skills and qualities that you probably already possess and practice all the time. In terms of reliability, it's important for policymakers that you provide accurate and timely information. They need to know that when they call you, they can find you, that you respond to their emails and phone calls, and that when you provide them information, it's actually correct. That's very important. You have to be accessible. You have to be available not only for the first meeting, but then later meetings. They might want to meet with you at another time. You're coming into town another date. They may want to meet with you. It's important to be available. It's a relationship, not a one-night stand. You know, you're establishing a relationship with someone. You're getting to know them. You want to work with them. You're going to have to be accessible and meet with them probably multiple times before that relationship starts to get solidified. So you need to be thinking like that when you go into these offices for the first time. And you need to understand that you're going to have to work with both staff as well as principals. So for Congress, congressional staff, as well as members of Congress sometimes. For administration, civil servant staff, as well as political appointees. You know, it's important. And number 1 rule probably for people like me in Congress, and I think or just generally doing this kind of work, and I think it applies to you as well, is don't bypass the staff. Don't treat the staff badly. The staff are important. They're the conduits for information. So please always treat them with respect. They will be your first line of communication almost 100% of the time. And then finally, you need to be persistent. You need to follow up to achieve your goal. It's not going to just be a one-meeting deal. It never is. You have to, you know, send the follow-up email, send the thank you email, answer their complicated question, do a little research about that data you discussed but didn't have at your fingertips during the meeting. And if you don't get an email back the next time you try to schedule a meeting, you email them again. You assume people are busy. I lose emails in my queue. You do too. They do as well. So, you know, just be persistent. You've got to follow up to achieve your goal. And again, our timeline is long, so we have time to make sure that we're doing these kinds of things. Next slide, please. The next kind of thing you need to think about is identifying your goals. And I think in this particular case, when we're trying to help people understand the Ryan-White program and its benefits, we want to do 3 things. We want to educate policymakers about the Ryan-White program and why it's important. We want to engage policymakers. We want to help cultivate them in a way that makes them want to learn a little bit more about the Ryan-White program and how it relates to HIV issues. We want to get them interested by giving them that taste of meeting you and learning about the program so that they can engage with us hopefully on a longer-term basis. And we finally want to cultivate that policymaker as a potential champion for Ryan-White and HIV issues. You won't always have every policymaker who's your target going to be a champion. It's really rare to find champions, but you always have to think about and evaluate whether someone is going to potentially be a champion. Kind of track how they're responding to you and what they're saying, and really think about, you know, when you want to approach someone who looks like they really are getting more invested and involved or willing to work with you. So that's always going to be the goal. It won't always come to fruition with every single different person, but it is the goal. So educate, engage, and cultivate are the 3 goals. Next slide, please. We're also need to develop a strategy to achieve our goals, right? That's a life skill that we all have. And so the 3 ways that we do that in this case are, first, we target the right people. We have to identify who the influential policymakers are. Do they sit on the committee of jurisdiction? Are they from the right state? Are they in leadership? Is that staffer the right staffer? Are they the staffer for the committee? Are they a lower level staffer that works, you know, that we might want to get to know first, but then we need to bump it up to the next level? You know, we got to target the right people. So sometimes it takes a little research to do that. So don't be worried about being a little bit confused sometimes or bewildered. Sometimes it takes asking questions. Definitely people like me, Robin, Andrea, others that you work with through this process will be available to you to help answer those questions, but obviously targeting the right people is a critical first step. The second thing is identifying partners who share our goals and can help us communicate the right message. Partners can be lots of different kinds of people. We'll go through that in a minute, but it's often very valuable to not be the sole voice on an issue. And so thinking about who can talk the talk with us and help reinforce our message is an important thing for us to do and think about and develop as we develop a strategy to achieve our goals. And then the last thing is communicating our message with stories, data, and documents. We need to not only communicate our messages in person and by email and on the phone, but then we need to have the stories, data, and documents that are available to reinforce that message that we're saying, to be the evidence for the truths that we're telling. So those three things, targeting the right people, identifying the partners, and communicating our message with stories, data, and documents, are the things that we need to work on to develop a strategy to achieve our goals. Next slide, please. The first thing we need to talk about then is identifying the targets. You know, who controls the issue? So it's different depending on what body. So first you're going to think about, am I dealing with a member of Congress or an administration agency or official on the federal level? Or am I dealing with staff in that realm? Or am I dealing on the local level with local elected officials or maybe a local executive agency or official or staff person? So you have to really think who controls the issue. And then when you figure out who controls the issue, so let's say Congress controls the issue, a lot of issues around Ryan White, reauthorization, for example, funding. Then you got to figure out, you know, who in Congress you want to be targeting because they sit on a certain committee that controls the issue, because they've expressed an interest in the issue, because they've spoken on the issue before, maybe just because they're from your state and they're the people you need to be talking to because we want to educate people from each state and they're in your congressional delegation. You know, thinking through maybe with someone like me or someone else you're working with about who controls the issue and really titrating down to that right person or a couple of people is an important first step. The second is developing, next slide please, developing a strategy is identifying partners. For us, partners must share our goals and carry the same message. It's so important because the power really is in the number of people saying the message, the unity of that message, the consistency of that message, and the repetition of that message. So we want to think carefully about partners and not bring just anybody into our circle of advocacy. We want to make sure we're selecting the right person who's going to say what we agree with and what we are saying to the policymakers and to share our goals. So, examples. Obviously, working with someone like me or Andrea on the advocacy in terms of policy education, or maybe Robin on communication support. We're staff. We're professional staff for professional organizations that are working on these issues that you belong to. You can work with us as a partner to help, you know, craft messages and figure out the right targets, all of those, identify other partners, you know, all of those things. But there are other kinds of partners that are very valuable to have. And those include people like board members who might be active in the community or who might be politically active or who might know very important people, including the decision makers and the policymakers we're targeting. Volunteers, the same way. Maybe the person who helps put on your clinic's charitable event every year is an important volunteer, or maybe your volunteers are sometimes patients who have really important stories to tell. You know, those kinds of people can be really important partners. Community leaders, donors to your clinic or other kinds of donors that are giving to HIV causes, allied local organizations, HIV community-based organizations, patient organizations, other public health organizations, other medical provider organizations. There are all different kinds of partners that you can have, but selecting a partner is about making sure that partner is going to, you know, be on the same page as you, as well as be persuasive because they represent a stake in the issue. And so those are the things to really think about when you're identifying partners. Next slide, please. Developing a strategy around communications and communicating the message is really important. And, you know, here are a few tips, but I'm going to turn it in a second to Robin to kind of reemphasize some of the things that we said in the first webinar related to this. But in terms of, you know, top line tips, communications need to be short and to the point. In almost every kind of policymaker outreach, especially in the beginning, people are time pressed. And so you have to come in really prepared and know, okay, this is my goal for this meeting, here are the talking points I have for this meeting, and I need to give time for questions, in case that person has questions or things they want to ask me about. So definitely you got to be short and to the point, elevator speech, outline. Use stories or examples. They can be very persuasive. We can talk about systems and diseases and things that are very complicated, but the way we make them real to people is through stories and examples, patient examples, your own personal examples practicing, stories of what occurred. You implemented a new type of program, and here's the outcome that it had. Very specific. That really helps people grasp the concepts. Including recent facts or research is also extremely helpful, and these can be facts or research that relate to that policymaker's district or jurisdiction that they're working on, or it can be from your clinic specifically that you've collected. People are very interested in that kind of specific information. Highlighting important points is always, I think, really critical. I personally ascribe to the idea of primacy and recency. The one or two important things I want to say at the beginning of my meeting, and I want to say at the end of my meeting. So I want to reemphasize at the end. So I want to bookend my meeting with the most important point or points first and last. So think about that. The in-between people tend to forget sometimes, but they do remember usually the first thing you said and the last thing you said the best. And then finally, always say thank you. You will never be dinged for being a gracious person, and everybody appreciates being thanked. I know how much you all appreciate being thanked by your patients and coworkers. Same thing goes for people who are working as policymakers. Oftentimes, especially staff, they don't get thanked by anyone. They're treated very badly oftentimes, and they really respond to you if you're gracious. And everybody likes being thanked, whether they did something or not. It never costs you anything to be gracious and thank people. So I'm going to stop just for a second and see if Robin wants to chime in here on some of the communications issues. Robin?
Can you hear me okay?
I can hear you, sure. Thank you.
Okay, now you can. Okay, great. Well, hi, everybody. Good to talk to you again. Jenny already touched on a few key points, but I'll go ahead and highlight just a few others. A reminder, we have the link still up on the site, as Andrea mentioned, so if you want to refer back to even more detail, please feel free to do that. The link is still up and is still live. It is really critical to do some advance work before these meetings and to really know your audience. We've talked about whether you're meeting with someone at the federal, state, or local level. Do you know if the individual with whom you're meeting has some kind of a health or a medical background? Sometimes they will. Do you know if personally they or somebody in their family has been touched by the disease or affected, or a good friend? Sometimes this is public information. You might know some public stand that they have, how they voted, whether they've come out with public statements, and really target for your audience. Do want to remind everybody to go very easy on the jargon, and related to that, to define terms that just roll off your tongue very easily, may be very foreign to the ear of the people that you'll be meeting with. The use of pictures and graphics and being able to help people, quote unquote, see what you're talking about is really helpful. Painting a picture, tying it back to their district, their constituency, works really well. It's a very effective way. And at the end of the day, what you're really looking to do is become that expert in a trusted relationship. So again, rounding out some of the tips that Jenny offered so far, these are just a few others. So I'll turn it back to you, Jenny.
Thanks, Robin. Those are really great points. And we're going to talk a little bit more about that research angle that you said in particular, about really knowing your audience, because I think that is another very important point that we can't emphasize enough, especially in this new environment where we're going to have to meet lots of new people. So thank you so much for that.
Sure.
As Robin also just said, pictures can be worth 1,000 words. And I want to, next slide please, talk about using clinic data or research to make your point. And I think that, again, the specificity of these kinds of details is very important because it gives a story, right? And selecting data or research that are recent or current is very important. Within the last 2 years is ideal. always as recent as possible. That's objective. Obviously, validated research is better. I think people, are attracted to specific stories, obviously, or examples, but it's great when we can actually show a more objective confirmation of that anecdotal point. That's very important. Something that's authoritative, a respective resource, is very important. Obviously, something from NIH is going to be seen as very authoritative, but something from your clinic could be equally authoritative. I mean, you have a lot of experience. You're dealing with hundreds of patients oftentimes, and so the trends that you're seeing are just as important. So I just think presenting that resource as authoritative and respected as possible is always important. And then understandable, obviously, that simple and easy to explain point that we were talking about earlier, especially because a lot of the people you might be talking to are unfamiliar with HIV. And if we could have the next slide, please. If you look at this picture, I think this is one of my favorite slides that I use on Capitol Hill a lot when I talk about funding for the Ryan White program. This is the Ryan White program's viral suppression rate for the program over the last 6 years of data that they have, 2010 to 2015. And, it's been fantastic to be able to point to specific outcomes in an easy-to-read chart. Even the most, numbers, comfortable, person who doesn't work on health policy could understand this if you explained viral suppression very simply to them, which you can do in 2 sentences, and then show them how well the program has been doing and the level of improvement the program has been seeing. This is something that you guys do in your sleep because your Ryan White grantees have to talk about these issues and report these data. So, but encapsulating this kind of information in this type of easy-to-read chart that you can use to walk a staff person through the story of HIV, viral suppression as a goal, and then the way that the program supports that, and then maybe adding your own clinic's data that might be even beyond these viral suppression rates to show that you're even surpassing those national averages. It's a great way to center your messaging and your communication during that meeting around 1 or 2 images that really help you tell the whole story and that help people focus on what you're saying. I think that's a vital tip. Everybody has probably one slide that they can figure out works best for them. And this is something, again, that I'm happy to help you with. Andrea and others that we work with can really help you figure out as you prepare for meetings to present your story. The other thing, next slide please, that I want to talk about too is the National HIV/AIDS Strategy, because obviously, people who do know a little bit more about HIV, especially at the federal level, will think, well, we're doing all this research at NIH and we're having all these programs for prevention, all this stuff at CDC, and then there's this stuff at HRSA that does treatment. There's a lot going on. Why aren't we doing better? Or why haven't we cured AIDS by now? Or why haven't we overcome this epidemic? Why are we spending all this money? Is it working? And I think, the viral suppression slide that I just showed you shows how well our program is working, but also orienting them through the National HIV/AIDS Strategy that in 2010 the federal government released that has 4 goals. A lot of states and localities have adopted their own local HIV/AIDS strategy, and it's helping us to think about what steps we need to take and what outcomes we need to meet to actually achieve an AIDS-free generation. And I think when people know that there's a plan, they feel a lot less overwhelmed, concerned, or frustrated with the amount of activity, but maybe in their minds not enough outcome. And, in some offices they might be like, oh, well, that was just an Obama administration document. That doesn't really matter to me. Well, that's fine. But maybe there's a local document that came out of that process that you can talk about that does impact their district, because a lot of localities, including states, did their own documents or in their own process right now, and I think sharing that with folks is very, very important. I want to stop again just for a minute to see if there are any questions. We've gone through a lot of material. We still have more to go through, but I don't want to ignore any burning questions now. And again, we're going to have another question period at the end. So if we can open up the lines, please, let's see if anyone has a question. We're still trying to open the lines. Hang on, everybody. Yeah, the lines are open now. Anyone have a question that they want to chime in with now? Okay, if not, that's fine. Then we'll just keep moving forward, and again, we'll stop at the end for questions, or you can chat to us through the chat box with your questions. We're going to mute the lines again and keep moving forward. The other thing I want to talk about is things to remember when conducting a meeting. I think the next two slides are pretty important because I see these as some of the important things to remember any kind of meeting that you're conducting with a policymaker. No matter who that policymaker is, these kinds of guidelines will really, really help you. Number one, as Robin said, you got to research the policymaker before the meeting. You have to know that who you're talking to and who your audience is. There are a lot of ways to do that now between the internet and talking to people who are knowledgeable. Folks like us will help prepare you for specific meetings, figuring out what committees that person is on. Those kinds of things are important. Maybe asking folks locally that you know, oh, do you know this member of Congress, or have you worked with this council person? Those kinds of ways of researching are very valuable. You need to know your audience. Number two, as I mentioned before, meetings are often with staff who are often young and not always knowledgeable about HIV. I mean, don't be offended if you're meeting with a 25-year-old. That is not unusual. Capitol Hill in particular is very much engined by young staffers, and many staffers are still in their 20s or in their early 30s. They may not have health policy masters or medical or other kinds of clinical degrees. They may not have really learned about HIV other than their sexual health class that they took when they were 13. People just may not necessarily, they may be new to their jobs. So don't bypass the staff. Don't think that just because you're meeting with somebody young doesn't mean that they aren't important, and oftentimes a conduit for this information to the decision maker, which could be the legislative director, or the chief of staff, or the member of Congress. So just understand that and simplify things for them and be respectful regardless of their age. Introduce yourself and others obviously is really important, but identifying yourself as a constituent or a person who serves the constituents from the district is often very important if you're dealing with an elected official. For example, you may not live in a congressman's district, but if that congressman is important to meet with and your clinic is either in that district or serves patients from that district, that's a district connection that you should describe. And that oftentimes is the case, especially more rural places where there may be fewer clinics in the state that are Ryan White clinics, but they serve a huge swath of the state. And so you could go to a lot of members of Congress in that state because you're serving clients from all of their different districts. Thanking the policymaker for his or her time, that's always critical. And stating your point of the meeting, again, at the beginning, and then maybe kind of repeating it in an appropriate way at the end. In a Ryan White meeting, I'm here to speak with you about, the Ryan White program and want to tell you about why it's important to our community in, jurisdiction X. It can be as simple as that, just sort of setting the tone for the meeting by stating the point. Next slide, please. Things to remember when conducting the meeting, obviously, we've talked about this. It bears repeating. Be brief and to the point. Have an ask. Oftentimes, people will meet with decision makers, but they don't really ask for anything, because the decision maker expects you to ask for something, and it's important to do that. So the ask in this case might be, I just really want to tell you about the Ryan White program and why it's important in hopes that you will support the program because it deserves support, and here's why. And then you go into your meeting. That could be your ask, and that's an educational ask, and that's appropriate. Listening as well as talking is critical. You want to listen to what people are saying, especially because a lot of times people are telling you things without saying the words you're used to hearing. So sometimes people say no to you in these meetings without ever using the word no. They might show reluctance. They might say, well, we're really going to have to get back to you, or I don't know if my boss is going to be comfortable with that, or this is a really new issue for us. I don't know if we have the bandwidth for it. Those are all ways of saying I'm hesitant, or possibly they're a way of saying no. So you have to really listen. You also have to listen for questions and take note of questions or concerns so that you can either address them in the meeting if you know the answer, or if you don't, be honest. Just say, I don't know, but I'm going to check, and I will get back to you with the answer or the best I can do, in the next few days. And please, if you promise something like that, please deliver on it. Please get back to the person, even if it takes just to say, hey, I'm researching this. It's going to take a lot longer than I thought. I'll get back to you in a couple of weeks, or I didn't find the answer. It's not available. That's fine. You can always just make sure to actually follow through. That's the most important part of it, so that they feel that you're respecting their questions or in consultation with them. Also, acknowledging positives and negatives aspects to the issue. Syringe exchange programs that we've worked on are a really good example of this. A lot of people will go in and be like, syringe exchange programs are really important. They help prevent people from getting hepatitis C and HIV and other bloodborne diseases, and they help connect people to drug treatment, and there are all these great things we want to say about syringe exchange programs, but a lot of times we neglect to say that maybe some of the negative things that we need to say to acknowledge that it's something we need to work on as a group. For example, things like, well, in your jurisdiction, we tried to establish a syringe exchange program, but the police commissioner had a problem with it, and so we're working with him. Admitting that as you're doing a meeting on something that important is important to do, because you're wanting to be honest about all the aspects of your issue without undercutting yourself. But by saying something like I just showed in the example, is saying that, hey, we know there are great things here, we know there's some challenges, we're working on these, we're talking to people in the community. As long as they think you're being honest and that you're working on an issue and really working on the positive and negative aspects of it, I think that'll be fine and be respected and appreciated, because politicians in particular who are elected, they're really concerned about negatives. They're very concerned about being accused of supporting something that's not supported in the community. So they might question community support. So being able to prove that people in the community support something can often be very critical to achieving traction on an issue. Oftentimes you'll have to get the meeting back on track. People go off on tangents. People ask questions. Those questions might take a lot of time, and you only have 5 minutes left. You need to steer the meeting back to what you need to achieve in that meeting, if only at a minimum, to make your ask, and then find ways to answer people's longer questions after the meeting, calling them later, sending them a follow-up email, getting them the data they asked for, getting that meeting back on track while not ignoring the issues that they're talking about or concerned about. Obviously, we've talked about sharing written materials and data, all very important. Leave behinds are written materials. So there are things you leave with the staff person that they can look at later. Oftentimes those are more helpful digitally, so even still we print things out and give them out, we still need to often send them digitally in our thank you notes. So just know that. You have to add things to your thank you note, like the materials you shared and the materials that maybe answer the questions you discussed. And then finally, you got to thank again at the end of the meeting. People remember the thank yous. So make sure to do that, please. Thanks. Next slide, please. And in terms of a Ryan White meeting, there are basically 4 rough components to it. You're going to introduce the policymaker to you, a Ryan White program provider, a medical provider, and explain who you are and where you work and all of those things, and what you do for the clinic. You might be the clinic director, you might be the clinician seeing a certain kind of patient. Explain who you are and what you do. Describe what's important about the Ryan White program in terms of your particular clinic, how it impacts the lives of patients from the district, hopefully, that you're serving, or just generally how you're serving those people, and describing those kinds of outcomes and facts. Explaining how your program is succeeding, using the data, the viral suppression data maybe, to show how well you're doing. Asking the policymaker to support the Ryan White program, when you've made the case that it's a successful program. And then finally, being that go-to resource. If they have questions about HIV, often to get something, you should give something. And I think the thing that you guys can most readily offer is your expertise. Say to that staff person, I'm happy to answer any question you have about HIV. Feel free to email me at any time. Here's my card. Or call me. I'm always happy to be a resource. Or if there are other health issues you have questions about, I'm happy to connect you to the right resources. They're going to really appreciate that, and they're going to call on you one day, and that's going to be helpful. And they're going to see that as a give and take relationship, which is very positive. Or you invite the policymaker or the staff person to your clinic to visit it. I often say, are you somebody who comes back to the district regularly? And if they say, oh yeah, I do go to the district a couple times a year or every month or whatever, I'll say, well, that would be great. We'd love to invite you to visit this clinic next time you're home, or let's try to pick a time when you're going to have time in a longer recess, like in August when you're home for 4 weeks. Let's try to make that happen, and then work with them on that, because it gives you an excuse to talk to them and to continue to be engaged with them, and to get them to your clinic where, a picture's worth 1,000 words, a clinic visit is worth 1,000,000. That experience, off the charts, usually the best way to really get people to be interested in the issue. But at the end of the day, these meetings are often short, 15 to 30 minutes, and you have to be succinct, and you got to keep it simple. People got to understand what you're talking about. You can't talk like you're writing an article for a complicated medical journal. You got to keep it simple and be very explicit, just like you are with your patients. Next slide, please. Cultivating a champion is also important, as we mentioned before. And again, these are champions that might be people who you meet with, and it's a good staff person or a good member of Congress or other kind of local policymaker who seems interested. And you're going to target them maybe because they're on the right committee or agency of jurisdiction. You're going to maybe hear that they're interested in this issue, or that they've done past things that mean that they might be likely to support HIV or the Ryan White program. You're going to, always keep your local connections in mind. Maybe allies know these people and they could be good champions. Maybe they're relevant patient stories that connect to this particular person. Maybe they're clinic visit opportunities that make sense that could help cultivate that champion. Figuring out how to best connect with somebody is partly a listening and partly a creative activity that you should be always sort of engaged in. And then obviously expecting to speak with a policymaker more than once. It takes time to develop a relationship of any kind, and this is no exception to that rule. And then next slide, please. Obviously, the timeline is very important, and sometimes the timeline is going to be rapid. You know what? Something's come out. They want input on a bill. They want to mark it up quickly. We've got to talk to them very rapidly. But if it's an introductory educational process, like what we're talking about today, we're going to have a longer calendar. We're going to have time to meet with policymakers, identify the right ones, meet with them, present our stories and our data, respond to follow-up questions. We're going to have time to think about whether there are press or social media opportunities that match well with that new policymaker we're trying to engage. We're going to have time to organize a clinic visit. We're going to have time to think about allies to reinforce our message. All of these activities are things that we have time to do because our educational process is a long-standing one that will last months, if not years, in terms of trying to get people to support the Ryan White program. It's a marathon, not a sprint in this case. Also, a case study of how well this has gone in the past has been the ability to maintain and sometimes increase Ryan White program funding. We've been able to get, Congress annually, as I mentioned, allocates funding. Organizations like HIVMA and the Ryan White Medical Providers Coalition work with inside the Beltway AIDS Budget and Appropriations Coalition, and we advocate for the Ryan White funding, and we work with you all to help really strengthen that advocacy. And we do all of these different things over the course of the year. We meet with appropriators in DC. We work with you as medical provider constituents to work with congressional offices. We did 50 congressional meetings last year with the Ryan White Medical Providers Coalition. We did emails and letters from HIV organizations, sign-on letters, individual letters, individual emails. We did call-in days. We did social media alerts where people tweeted certain messages on certain days to highlight HIV issues or pressing policy issues that related to funding. And that advocacy over the course of just 12 months, results in the last few years of us being able to maintain and sometimes increase Ryan White funding. And, that kind of practice applies to even a longer term educational advocacy campaign like we're doing here with the value of the Ryan White program. We just maybe have a little bit longer of a cycle to do it over, but all of those things can be done in a year or they can be done on a longer term process. Next slide, please. As we think about this new era that we're in, where we're really beginning to be more focused on citizen advocacy, and people are more interested now in kind of talking to the government and protecting things they care about, you have an opportunity not only to work with us to do these types of webinars and trainings and to get to know policymakers and the process for doing education and advocacy, but you can also do things at home that hone your skills during the times in between these activities. You can attend a local event and meet policymakers. I think that's one of the best ways to get to know them. Go to a town hall about something and just see what the policymaker has to say. Sometimes I do that just to hear a policymaker. It may not even be on an issue that I'm working on, but I want to see what they're going to say. I want to get to know them a little bit. I want to hear what kind of stories they tell. The opioid epidemic has engendered a lot of local advocacy, and policymakers have done lots of town halls, and it's something that's related directly to HIV. So if that kind of event is going on, for example, you could go to a town hall and really hear about something that's probably on point, if not indirectly related, and really get to know that policymaker as it relates to health and public health. And so I suggest you guys do that. These are free events. You can get on the policymaker's website and figure out when they're doing local town halls or other kinds of meetings, and that's a great way to get to know people. Also get to know the local folks in your community who might be allies for your messaging. Those are the guys who are going to those town halls oftentimes. You can also educate your local leaders, obviously, not just the policymakers, but other kinds of leaders that you know, business owners, philanthropies or charities that you work with, the community leaders that you know that might be in different sectors like education or the university or religious organizations, other kinds of vendors that your clinic uses, just sort of to cultivate, your future allies and to think about how those local leaders could help you in these larger educational campaign processes. And then, finally, using social media. How do we follow HIV issues in that realm? I mean, we have a president who tweets, a candidate who tweeted, now a president who tweets, and obviously, social media is more and more important. A lot of younger people are using video and Facebook and other kinds of social media tools. For the policy space, Twitter is still incredibly important. That's why I have the Twitter bird superhero on the slide. This is something that policymakers still use and follow, especially on the federal level. So you can follow the hashtag, hashtag HIV, to sort of see what people are talking about. You can follow HIVMA to see what policy issues are important or events are happening. Or you can tweet at or follow your local lawmakers. I have Representative Barbara Lee's Twitter handle here because she's a leader on HIV issues in the Congress. She co-chairs the HIV caucus in Congress and also is somebody, just to show the example that you could follow, or you could actually use that address to tweet at her publicly unless she's following you, and then to show her, that you care about some of these issues too, or your own representative or your own senator that you care about these issues. It's a way to talk to them, and I think it can be very powerful still in this policymaking realm. And then lastly, and then we're going to open up for questions, we included a couple of resource slides. The first one is just this list of resources for both HIVMA and the Ryan White Medical Providers Coalition, as well as for some of the policymaking institutions and agencies that we've talked about today, including the Congress, the Capitol Switchboard, which is how you can call any member of Congress, and HHS and HRSA, and AIDS.gov, which is the website around HIV/AIDS issues that the federal government supports. And then also in the next slide, navigating the ACA repeal process and its potential impact. Really good articles that Andrea Weddle from HIVMA identified for us that you may want to read that really helps us understand, what the process for the ACA discussion is going to be legislatively and administratively, and the things we need to look for and watch for and the timeline, as well as some analysis and data from Kaiser Family Foundation and Urban Institute that really are useful data points for this discussion that medical providers like us may want to use. And then lastly, Andrea and I are both on the line to answer any policy-specific questions that you may have that don't relate to the process of advocacy and education that we've talked about. But if you do have any policy-related questions, we are here to answer that, as well as Robin, who's available to answer any messaging and communications questions that you might have. So with that, I'm going to open it up for questions, and I really appreciate everybody listening and participating so well today. Thank you.
Thank you, Jenny. And we did receive a couple through the question dialog box. Can you hear me?
Yes, I can.
Okay, great. And the first one asks about guidance for speaking with policymakers, both who are friendly versus those who may not be as familiar or as friendly to your causes. So any tips in that area? And then the second one is really a follow-up on the leave behind, what you should leave behind with offices. How much is too much, fact sheets, FAQs, and should you share that prior to the meeting?
Okay, that's a great, I'll start there because that's a really good question about leave behinds. I like to have leave behinds that are very specific to the constituent. So if you're a medical provider from a senator or congressman's district or state, then you want to leave behind your clinic brochure for sure, and your card. And you probably want to leave behind, simple slides or the data points that you may have discussed that could be in a fact sheet. They might be just a slide like we showed before, you know, or a dashboard of a couple of slides that, you know, make the point, show the arc of your story. You may want to leave behind, you know, a fact sheet about your clinic if you have it that's a little bit more specific than the brochure maybe. And, you know, if you're working with people like us, we may give you leave behinds like a testimony that our coalition has put into the record around an issue, or some other data or talking points that we may want you to give out that are put into a, you know, a short, hopefully visually stimulating, you know, fact sheet. So I think, you know, less is usually more, simpler is usually better, but definitely specific to your organization and whom you're representing that day is always a very important piece to include. In terms of friendly versus non-friendly offices, I think the friendly offices are easy, right? You're going in, don't ever assume anyone's friendly, first of all, because you never know this is the person that you're talking to, right? You got to suss that person out. But if they are friendly and they show themselves to be friendly, or their boss has been historically friendly if they're staff, then, you know, it's a little bit easier. You're starting from a place of, look, we're coming to you because we know you've been friendly on these issues, and we really need your assistance and support now as we move forward and want you to help us, you know, make sure the Ryan White program endures. You know, then you go into your spiel and maybe have more of a discussion with them that might be, especially if they're educated and knowledgeable, that might be a little higher level. For a non-friendly or first-time office where you have no idea how much somebody knows, then I think, you know, you take it from really square one. You introduce yourself. You explain why you're there. You show, you know, the specifics in the simplest terms of, you know, who you represent, why you're there, about the Ryan White program, the things that are important to know about the program, why it's successful, your data. But keep it short because you're going to want to be able to answer questions too. And I like to answer questions during the meeting. Like, I prefer that style if you feel comfortable enough that they can ask you questions along the way. You show them a piece of data like the viral suppression chart, and you kind of wait and pause after you explain it, see if they have any questions. Then you move on. I think that's a little easier for people to manage sometimes. Or sometimes staff just look at you stoically, and then you finish your spiel, and then they have questions that they've thought about at the end. And but you have to make sure you leave time for questions when you're in a new office, because you just don't know what their level of experience or information is. I hope that helps. And again, you know, people should feel free to contact me later on. I've left my contact information on the last slide, which we'll put up. That, you know, so you guys, if you have questions you think of later, or if you come into a situation and want some advice, you know, I'm always happy to be available. Are there other questions, Andrea, that came through the chat or that folks want to ask now live?
There was one more about whether we were going to share the slides, and we definitely will share the slides along with a link to the archived webinar, and in that we will include Jenny's email and my email, and we really do want to help all of you put some of this into action. So please feel free to reach out to us for assistance and guidance, or if you have other questions that come up.
Absolutely, and definitely if you have ideas, because you guys are on the ground. You are reading your local newspapers. You're going to see articles that maybe need responses. You're going to see or hear about things that you think should be addressed in meetings, or maybe data that is good that you want to let us know about. Any of those things, please don't feel like you can't let us know about that stuff. That kind of information is very helpful to the work we do, and we're very grateful when folks reach out to us.
So, okay, so here's a good question. Where do we go to do research about policymakers' stands on issues, on various issues, and where they stand?
I think the first place I usually go is their own website, because everybody has a website, especially if they're elected officials. So you go, you know, look on their website, and sometimes their official website is helpful because it'll really flag the issues they care about the most, or that they're working on, or their committees that they sit on. But then also sometimes their campaign websites can be very helpful too, because they've had to have issue position statements that might be helpful for you to see. So those are two places. The other thing I like to do on people is I just like to Google them. Like, why have they been in the news? Like, sometimes you find out stuff about people that's really helpful. Maybe they've commented on an issue publicly. Maybe they've been cited on an issue. Maybe when they were a local legislator, they sponsored a bill that is on HIV, but now they're a federal legislator and they haven't gotten a chance to do that, but you know that they've commented on the issue or supported the issue. Maybe there was something that happened to them or somebody they know who's close to them, maybe in their family. Maybe someone, had an issue like HIV or substance use or something that may make them either more compassionate or empathetic or possibly maybe hostile to the issue. Those kinds of things. Some good Googling on folks is always worth doing in addition to looking at their official position websites as well as their campaign websites. Also talking to people. If you know folks who know them, like if your board chair knows that member of Congress and you know that, and you have to go do a meeting with that member of Congress, talk to that board chair and ask them, for some tips, for some information, how they think about HIV issues, or if a colleague knows them, or, a lot of you are at universities or places that may employ their own lobbyists. Those people may be regularly talking to these offices. And so if you have that kind of relationship, you may want to go talk to them, So I think there are lots of different ways at this, but do spend some time if you're doing something, on your own without our assistance for some reason, please, do these kinds of research activities. They'll pay off.
So one more came in, and that will probably make that the last one just because it's 6 o'clock here, and I know folks are probably ready to jump off. But it's a good question about where to find good leave-behind documents.
Well, we produce some good leave-behind documents on the Ryan White program. So we got at HIVMA and the Ryan White Medical Providers Coalition. Also, I think, sometimes they're good documents that the Federal AIDS Policy Partnership develops, which is a national partnership of organizations that are both national and local that are working on HIV. Sometimes they have good documents. The documents that Andrea highlighted from Kaiser and the Urban Institute at the end of the second resource slide, they have some interesting data. Sometimes, like a slide from something like that is useful. So there are a lot of different places to find. The AIDS.gov might have good fact sheets and leave behinds, especially around the HIV/AIDS strategy. I think a good thing to do is to definitely talk to us if you're planning to go and talk to anyone about the Ryan White program or HIV. We'll be glad to steer you in the right direction, if not provide you with the information ourselves.
And we are creating, as part of this campaign, a central resource for promoting the Ryan White program, really targeted to policymakers and the media, and that will include these resources as well. So we will definitely let everyone know about that when that is live. But with that, I really want to thank Jenny for a wonderful presentation, and Robin, too, for sharing her expertise, and really everyone for taking the time to participate in tonight's webinar. It's so important in our new environment, and you all can really play an important role in educating the new policymakers who are in town on HIV and broader healthcare issues and the importance of supporting them. We will be in touch, and I hope everyone enjoys the rest of their evening. Thank you.